right, good morning and welcome back to Ivy League. We are so excited to have you. Thanks for joining us. Today we are going to be talking about a very important topic, the Nurse Practice Act. So all of us here are nurses, as you know, and I'll start with introductions. I'm Eve.
I'm Melissa.
I'm Lydia.
I'm Saori.
Perfect.
So today we're going to tackle the Nurse Practice Act, what it is, why it matters, and how it shapes nursing practice across the U.S.
So let's make it really simple. So what is the Nurse Practice Act? It's also known as the NPA, and basically these are the laws that tell us nurses what we can and cannot do. And you kind of have to know what's going on in your individual state, especially if you're a nurse that practices in different states.
Exactly, and each state enforces it through its Board of Nursing. Each state has the same goals to protect the public and to make sure that nurses provide safe and competent care.
So you do the crime, you do the time.
And how would we do that? And we're going to go ahead and tell you that.
All right, so first, one of the main purposes of the NPA is that it highlights and very clearly outlines what a nurse can do within their scope of practice. So for all different disciplines, so either an RN, an LVN, it really kind of depends, but it's going to legally tell us what we can and cannot do.
Right, so that's what keeps us from stepping outside of our lane.
Exactly. Second, it sets standards for nursing education. Schools have to meet specific required for curriculum, faculty qualifications, and clinical training. In California, for example, the BRN reviews nursing programs to ensure every graduate is prepared to practice safely.
And third, it establishes licensing requirements, such as completing a nursing program that is approved, passing the NCLEX, and continuing education to keep your license active.
Right? I talked a little bit about what they do, and unfortunately that means that when somebody's doing something wrong, they also regulate that piece. The NPA tells us what they consider to be professional conduct and how we are supposed to ethically operate. And this is a really big deal, right? We have a lot of patients with different walks of life, with lots of different family dynamics and things, and this is going to help us to make sure that we're providing the safest care while advocating. But also making sure that we're preventing negligence, right? So really important piece.
That's absolutely true. But if a nurse doesn't, then the Board of Nursing has the authority to investigate any key complaints that's brought to attention.
And disciplinary actions can range from fines to suspension or losing your license.
And I've been to nursing trials with the BRN, and it's like being in a courtroom in front of all your peers. I would never want to go there.
No.
That's why it's more important to not be negligent.
We're talking about negligence, right? So that could be whether we mean to do it or not. And this is why the Nurse Practice Act outlines kind of what we need to do so that we can make sure that, like you said, we stay in our lane. And we want to make sure that we're preventing negligence as often as we can. So how do we prevent it?
But usually we want to make sure that we're following standards of care, we're doing our thorough assessments, documenting accurately, communicating with our patients' families, and asking whenever help is needed. So.
Another thing we can do is just doing the fundamentals consistently each time.
Yeah, I agree.
Yeah, exactly.
Exactly.
It's important to know too that California rules differ from other states.
Yeah, between, for example, we live here in California, so let's talk about California to Texas. So Texas is a part of the Nurse Licensure Compact, but California is not. So that's going to impact how your license works in different states. And you got to know that before you just show up and try to go to work.
Exactly, and since we all have a license in California, that means we can only practice in California. Meanwhile, other states such as Texas are under the Nurse Licensure Compact, so that means that they can practice in other states that are under that same organization.
Perfect. Okay.
Yeah, that's great to know in case if you want to get into like travel nursing.
Oh, absolutely.
Yeah, definitely.
Get that money.
Right. I have a friend who's an MP in Texas, and I remember him telling me that he needs consent from a physician in order to write a prescription. Meanwhile, here in California, MPs can prescribe medications or just anything else independently after a transition period.
That's interesting because it appears like a lot of the APRNs have a lot more autonomy in California. I wonder how like the differences like in disciplinary guidelines are.
Yeah, one of the things that, I was doing a little research before we got started this morning, and it really depends on what the disciplinary action depends on the magnitude of the violation, right? So they're going to be looking at gross negligence. They're going to be looking at, was the person incompetent when they were practicing under their scope? Sometimes you can lose your license for making a mistake, right? You could go on probation. You might have to reappear in front of the board, maybe do some additional continuing education, maybe work restrictions, all of those things that have to be reported, unfortunately, then to your employer. But like, for example, in Texas, maybe the same issue with the same amount of negligence or what have you is going to get a lesser sentence, if you will. And again, this really hones in on why you have to know what you're supposed to be doing with your license, but in that state that you're practicing.
Right. Let's hope that none of us have to experience this. It is nice to learn how rules and regulations can differ from state to state.
Yeah, the scope of practice and disciplinary guidelines may vary, but at the end of the day, our common goal is to always keep the patient safe and to protect the public.
Absolutely. Now that we've discussed the different rules in each different states, we're going to move on to our next segment.
Okay, awesome. So we talked a little bit about ethics, and I'm just kind of wondering, have you guys ever faced like an ethical dilemma while working in, ICU or emergency room?
Yeah, I've definitely experienced conflict among patients and family members regarding their decision to either uphold or withdraw life support, life-sustaining care, or DNR orders.
Sad.
Very sad. During COVID, the pandemic, there was such a shortage of beds, medications, ventilators. A lot of devices weren't available for us. So I remember we had to decide which patients were critical enough to be seen and treated right away, which is really, really sad to have to be the one to decide that.
Yeah, and I mean, in my experience, I've seen that when patients refuse that treatment, unfortunately, right, they pass away.
Yeah.
There's a lot of dynamics with the family because the family has different ideas about how they're feeling and how they're projecting their wants on the patient, or even like little things, just families bringing in junk food for patients that maybe are NPO or on really strict diet.
Yeah.
And then we gotta chop it up with the families, right? Okay.
It was ordering hot sauce.
These are great examples. Since this is common, what should an RN do if an ethical dilemma were to occur?
Yeah, for me, I feel like I should address the patient's ethical conflict by noting the parties involved and what is true about the case. Also, I should plan the course of actions by involving the ethics committee to uphold the patient's wishes and values, as well as evaluating some of the risks and benefits, and ensure that the ANA Code of Ethics is followed throughout the whole process. And once a decision is made, I should assess the results and address any moral distress that may have occurred during this whole process.
Yeah, takes a lot.
Wow, that's a lot. It's a lot to deal with. Well, I do want to add to that. We should have be able to have open, honest communication with our patients and their surrogates about their condition and like what type of intervention is going to happen until, as long as we're within our scope of practice. Of course, we want to stay within our scope of practice. I believe this will empower them to make a decision based on all the information that we're able to give them and educate them on. Afterwards, I would definitely make sure to document the conversation, the interventions, and the decisions that were made, and also make sure to include all the parties that were involved, whether it's family, the advance directive, or the power of attorney. Make sure those are all inputted into that conversation for documentation purposes.
Those are great suggestions, Melissa. How should charge nurses and nurse leaders handle these sensitive situations?
Ooh, I'll take that one. So I've been a charge multiple times, and I think it's really important during my shifts that I'm ensuring that the team that's there can actually uphold those minimum standards of care. Obviously, we always want to go above and beyond, but sometimes we can only do the minimum. And then, as we know, I'm super type A, so I'm not afraid to address those concerns and kind of just, go through those conversations even when they're difficult. And then if needed, we can do disciplinary action for those nurses that are just unfortunately not up to par. But I'm also really big on advocating for my team and addressing the concerns that are going to lead to patient harm, identifying issues, ahead of time, and making sure that they have the proper training and support so that when these situations arise, that they're, better prepared to handle them. Yeah.
Yeah.
I agree.
My charge nurse actually does the same thing too.
I like her.
Yeah, but I know, right? But she also creates and maintains an environment that encourages ethical practice by providing ethical training and empowering us to make the right decisions without fear of retaliation, because
Yes.
that's important
It's
too.
huge.
Like, I want to make sure that I'm protected through all this.
Yeah.
And also, she sets an example of ethical conduct too, because I mean, obviously, if she's not doing something ethical, like, it's gonna be hard for us to do
Mhm.
that as well.
Role modeling.
Yeah, and she also supports us when we advocate for our patients and challenges practices that compromise care. And she also provides emotional support when we experience moral distress or emotional fatigue, because dealing with, any ethical problems can cause that. And so it's good to have somebody who has our back at the end of the day.
Oh, I love
Mhm.
that. Okay, okay. All right. So, before we wrap up our segment today, we're actually gonna take a caller who might have a question on what we're talking about today.
All right, so our caller says, I'm a charge nurse in the ICU. We recently had a patient who desperately needed a liver transplant, but they didn't meet all the eligibility requirements. The family was begging us to do something. They couldn't understand why their loved one wasn't an eligible candidate. As the nurse leader, I was stuck. How do you balance compassion for the family, the patient, with the reality of strict transplant qualifications?
Oh, so I'm gonna take this one. I actually worked in transplant for years, and I had multiple situations where you had like somebody who seemed like they were a really good candidate, right? Like they're young and they're youthful and they have all this life ahead of them, but unfortunately they didn't meet the eligibility requirements, right? Whether that was lack of family support or what have you. So obviously you have the family who's really pulling for the patient. You're pulling for them because you want to treat them, but you have to be realistic with what's going to be accomplished. And for these cases, we would take them to the ethics committee that was located there in our hospital. And basically, a whole bunch of interdisciplinary people come in, they hash it out, they talk about long-term outcomes, and goals for these patients, so that when they are giving the organs, they're making sure that they're doing so in a very strategic way so that the organ doesn't go to waste. And unfortunately, that means, right, that patient went home without an organ. And they passed away, and it's really sad, but then it was our job as the nurse to really support like the family,
Absolutely.
when the patient had to come back in for another hospitalization because their organ continued to fail.
So then,
Yeah, we do have to look at a lot of the potential outcomes. That we want to make sure that we're not wasting organs, we're not wasting precious staff and time availability for example, like the OR. We don't want to be holding up a surgical suite that could be useful for another patient. So we have to be mindful about making sure we're not wasting a lot of our resources in that sense. But it's definitely hard having to deal with family dynamics when your loved one is in ICU. Everybody can feel it. So it's making those decisions besides what you feel personally and compared to what's the best outcome for the patient and
Right.
the actual organ itself. So
yeah, and I definitely feel like it's important to be honest with the family and make sure that you go through the proper channels to have these situations reviewed by the interdisciplinary team or the ethics committee.
Yeah, and that's what's cool, right? There's all these governing bodies that are going to help us nurses. CYA all day, okay? Cover your booty.
Yes.
You know what I mean? Okay.
Yeah.
if you don't document, it didn't happen.
Right.
So yeah, we appreciate you for calling in today.
Thank you, caller.
Yeah.
Thank you
thank
guys.
you.
It was so great having you guys on the show, and we will see you next week.
Yes.
All right, bye.
Thanks for